Welcome to the Healthy Aging Pod. I'm Kelly Yee. You can follow me on Instagram at Kelly Yee Yoga or subscribe to my YouTube channel at Avatar Yoga. In partnership with EPC Canada, we are excited to bring you our Healthy Aging webcast series. Our guest today is Neela White, a portfolio manager with more than 22 years of experience working in the financial industry. She advocates the open discussion and preparation of life-changing circumstances, both financially and emotionally, to be better equipped for potential long-term care costs. In addition to her financial experience, she holds degrees in psychology and gerontology and is an active speaker on the subject of caregiving and the sandwich generation. Welcome, Neela. So hello, welcome, Neela. Thank you for being here. How are you today?
You know what? I'm doing great for a Friday. It's raining and dark in Ontario, and glad it's Friday. And thanks for having me on your show today.
Thank you for being here. So let's just dive right into it. So I know you specialize in aging and finances.
Mm-hmm.
And one of the things that we know is that people in our population are basically living longer. And because they're living longer, we tend to have a higher risk of developing illnesses such as like diabetes and dementia. How did you recognize this importance of caregiver preparedness relating to finances, costs, and caregiver well-being?
I would have to say it goes back to personal experience. So I personally was a caregiver to my mom and dad for 10 years, and going through that experience and seeing what the gaps were in the healthcare system made me realize that part of the whole aspect of financial well-being, holistic planning, is that you have to plan for any sort of health crisis, any sort of medical emergency. Going through the experience with my mom and dad showed me that the government system is built to support X amount of dollars. And unfortunately, as you mentioned, we are living longer. It doesn't mean that we're living better or more healthily, which means as we age, we are going to require more and more help, which is going to cost out-of-pocket dollars. So I think it was really, I became quite aware of that maybe about 11 years ago now. It became one of the big things that try to educate clients on, just so that they are prepared.
And you also previously was in caregiving facilities, is that correct?
Yes, I have a degree in psychology and a degree in gerontology, and my first career was actually in a long-term care facility. Yes, so I think at an early age, you sort of get a feeling in a sense of, this is what I want my path to look like, and this is what I would like my parents' path to look like. So I guess the fortunate part for us is that we had all, as a family, started the discussion early to know what their hopes and wishes were.
So let's get to that in a moment. So a past discussion I had with Cindy, we had discussed how to stay financially healthy across the lifespan. And so because you're an advocate for financial preparedness, can you discuss this idea a little further to families on how to be better equipped?
I think part of what we need to do, both as people within a family and as advisors, I think we need to take a step back and look at within retirement planning. So, part of the retirement planning is a recognition of, now that I'm done working, I'd like to reward myself, a trip around the world, a brand new kitchen, whatever it is. And yes, we've worked hard our lives, we've saved, but I think part of the discussion within families, and just as an open discussion without stigma, is should part of that savings be put towards healthcare? If you don't need it, great. It can be part of your legacy planning to leave it for your beneficiaries. But if you do need it, at least you have the security of knowing there is something there to help you through until you can figure out, what do I need next for the next stage of my life?
That's a very, very good point. And probably a tough discussion to have.
completely agree with that. And I think probably because it's fraught with emotion. And I mean, obviously, this discussion of aging does lead down to when you require assistance, disease, and eventually death. And I think because of that whole D word, no one wants to deal with it. There's a lot of stigma around it. So it's a conversation that we just sort of back away from. I think it's one of the most important discussions we can have as adults, and even as adult children or children.
Okay. So speaking along those lines, you did mention about your own personal experience as well. So how has caregiving a parent, or should there be preparation from a parent to a child to care for you in this moment where you're talking about having that discussion? Based on your experience, how has this affected people's lives? So whether it's in the care homes that you worked on, your personal experience.
Mm-hmm. It adds a whole new level of responsibility and stress. I would have to say, because I was a caregiver to both parents, in addition to actually having a PSW, a personal support worker, helping with my dad and then my mom, it was probably the most stressful thing that I have ever done. I think it adds a lot of stress and responsibility to a plate that we're already finding full with responsibility, um, with working, with being a spouse, with being a mom, and the stuff you want in your own life. And I think it's a decision of, if I'm going to accept this responsibility of being a caregiver, what do I need to put on hold? How do I make this all work together, that it's a positive experience and not something that you go down the rabbit hole with?
And so I'm guessing, I mean, that would make sense as to why you would want to have this discussion, because to understand what your parents need or wanted, or want, should I say, and then what will work for you and your family at the same time.
Mm-hmm. Mm-hmm.
Again, very tough discussion, because it's not just the caregiving, like you said, it's the D word, which is the death part of it,
Mm-hmm.
accepting and acknowledging that that is inevitable, that's going to happen.
Yes.
And then on top of that, you're talking finances, which is
Mm-hmm.
also another topic that most people do not like to talk about, right?
Yes.
Like these are the two areas that we just don't want to talk about. So, but very important discussions to have. I know it's not easy to have this discussion, but this is definitely something I'm hoping that people will consider, and know that there are, resources, like yourself, probably very kind of rare in being able to look at, it's okay to be fearful of having this discussion, but the
Absolutely.
importance is, how do you want to, because if you do happen to get ill, what is exactly do you want from that, and what can your family help you with? So
And I think that's it. If you are relying on your children to be caregivers or powers of attorney, I think if you want and expect them to do the best job that they can for you, they have to know what you want. They have to know before something happens what you want. You definitely don't want to find out, you get a call at 2 or 3 in the morning saying mom or dad had a stroke. They can't communicate, they can't move. Can you come down to the hospital? You don't know that you're a power of attorney. You don't know that you're going to be a caregiver, and you don't know what they would have wanted. And suddenly you're being bombarded with questions. It's chaotic. It's extremely emotional. And we all know just from experience, it doesn't have to do with aging or crisis. When we are emotionally stressed, we do not always make the best decisions, period, right? Human nature.
very, very true. So now let's go into a bit of the from a financial perspective when it comes to caregiving. And you had also mentioned that you were in the sandwich generation. You had a family, children on top of caregiving, which
Yeah.
I think there's a lot of people that are going to relate to you, and there's going to be more so of this generation, because we're all living longer. And so the parents live longer, the children are going to have their own children, and you're the middle person and you're needing to care for all areas of your family. So onto the financial side, what are some key costs that people need to consider?
The biggest one that catches people by surprise is, I think there's a misconception that when I retire and something happens to me, that anything I need as far as care goes, if I'm living at home, the government's going to provide it to me. I think that is a mistake for anyone to assume that. The government can't afford to do that. So I think what you need to be prepared for is that, let's say it's toileting that you need help with because you cannot get yourself out of a chair, get yourself onto a toilet safely, get yourself up. Let's say you've had a stroke and one side's paralyzed, and that would be the side that you use to take care of yourself bodily. If in Ontario, it's Lynn, who does the arranging of government services. Let's say they're only able to provide you with an hour a day. I don't know about anyone else, but I can tell you, as I've aged, obviously things have changed with your bladder and stuff. Who can say that, okay, I am going to only go to the bathroom at this time when I have assistance, in which case you have to look at something like, if I'm only going to get X amount of time, what's going to cover the gap? So I think you need to have some dollars put aside for hiring personal support workers. I think you need to have conversations with those people who you think will be providing your care, like family, neighbors, community, whatever it is, to make sure that that's in place. And if it's not in place, you actually need to make sure that you have the resources to help yourself out to live as independently as possible. I mean, right now, the current number is from informal caregivers, so that's family, friends, and neighbors. Informal caregiving saves the government of between 24 and $31 billion a year. Imagine if all of a sudden people said, hey, I can't take time off work. I can't, cut my hours because I need it to pay my mortgage and do stuff. What happens? So I would say you need to set money aside for contingencies, hiring help if you were to have a health crisis, a health emergency, or your spouse, and you had to take time off work. What's going to cover the bills?
Yeah. And I do agree that, we can't solely rely on government or healthcare budgets, because we know that things are getting tight. Like,
yes,
we see it. Our population is also growing, so we also have to recognize that the healthcare costs could increase because our population, especially like we have these baby boomers, different generations that are aging, and we just have to accept that there might not be as much government assistance that we would like. What are we going to do with that? I mean, here is an example, right? The pandemic. How much money is going into that? Like, so that means we have to offset, or not we, but we as public, because it's our taxes and stuff. But the government has to make a decision. So it goes into this like fund of COVID care, and now we have less funds for perhaps those that need the aging care assistance. So that's also something that we need to consider, because these crises that happen too will take funds away from the government. And so how have you seen at all this pandemic impacting what aging adults should consider, again, for to prepare for these rising expenses? Like, what do you think? How do I put this in a proper way? Do you think that people should recognize this because as a result of the pandemic?
You know what? I think all of us, whether you're middle-aged, such as myself, or older, I think the pandemic has certainly put a real spotlight on lots of things in our personal life. So two examples I would give is, the first one would be your house, where you're living. I think what we see as we get older, that, let's say you have a 4-bedroom house or a 3-bedroom house. As you get older, it ends up being used the family room, the kitchen, the bathroom, and the laundry room. So, you start looking at things. How much space do I really need? What is it that determines home? If this is a bigger expense that I can manage and take care of, is there a way that I can say, hey, look, now may be a time to downsize. Here's this pool of money. I'm going to put it aside as a contingency plan. So I think those are things we can start thinking about now, looking at our environment, looking at our neighborhood, getting prepared, because I think there is no perfect time, but I can tell you the imperfect time is when it's too late.